have lateral nasal bone, axial-lateral mandible, and then the orbit-Reese method. You're going to first start off by going to get your patient, introduce yourself, letting them know you're an LIT radiology student. Then you would ask your patient to verify the full name, date of birth, and check their wristband to ensure you have the correct patient. You then walk to the room, ask LMP, description of injury, any pain, any surgery to the area, and then you want to remove any artifacts that can interfere, like bobby pins, necklaces, or anything like that. For the first one, we're going to do the orbit, so you want to make sure your patient is prone on the table. You want to make sure you raise the table up, have the tube detented at 40 SID, make sure your cassette is put in crosswise, and you want to center it, that way you can just move the table around and make it easier. So for the patient, you want to make sure that their head is at a 37-degree angle, making sure their chin, cheek, and nose are touching the table. For the central ray, you want to make sure you're on the outer canthus, and then when you walk around in front of the table to make sure your patient is not rotated or tilted, you want to make sure that the central ray is on the downside of the orbit of interest. You want to make sure your collimation is at about an 8x10, but you want to make sure that both the front and the back side of the skull is showing, and you want to mark it on the back of the patient, not in front of the light field. Make sure your patient is shielded. Instruct your patient to don't breathe, don't move, and make your exposure. For lateral nasal bone, you want to do it tabletop, so you would take the cassette out, put it on the table crosswise, have your patient in an oblique position, kind of in a 4 to make sure they're comfortable. You want to make sure their IPL, you want to ensure there's no tilt or rotation, so to do that, you would make sure their IPL is perpendicular. For the central ray, you want to center at the nasion, and you check your collimation, make sure it's good. For lateral, you would mark in front of the light field, make sure your patient is shielded, and it's still going to be 40 SID, and that's it. Don't breathe, don't move, and make your exposure. For the axial lateral mandible, this one's going to be done on the Walbucky. So your tube is going to be horizontal. You would make sure it's detented still, 40 SID. For the Walbucky, you would put in your cassette in crosswise, about a 10x12. For this one, the Walbucky doesn't move with the tube, so you have to move either or to make sure they're centered at all times. So for this one, you're going to have the patient lateral, whichever side of interest, and you want to instruct them to have their chin up and then bring their head in towards the board. You want to center at the angle of the mandible, and you want to make sure you mark in front of it's a lateral, so mark in front of the light field. Ensure there's no tilt or rotation, make sure your patient is shielded, and I think that's it. Don't breathe, don't move, and make your exposure.